Okay, good afternoon. Oh boy, let's try this one more time. Good afternoon. And the third one's gonna be the charm. Good afternoon. Okay. We have had a packed conference so far. On Monday, full day of pre-conference institutes for many of us. Yesterday and today, full days of sessions and plenaries, and this is our closing plenary of the main conference. Tomorrow we also have learning labs, and just really want to remind everyone, after this, immediately after this, we'll gather in the lobby at 5:15, and we will go over to to our spot where we will have the Rally for Social Justice. That is let's hear that. So we are really honored in that we have a dignitary who will bring us remarks from the city of Baltimore. Mayor Brandon Scott is here, and I have to say, he has been described to me by the staff here in Baltimore as the coolest mayor in the country. So you can judge for yourself, but one of the things that went viral, at least among some of us in the office, was a video of him talking to a social activist at a rally named Shorty in the middle or the beginning of the pandemic, saying, "Shorty, come on, put on your mask, pull up your mask, Shorty, come on." So as public health professionals, we have to love that, have to admire that, and I'm turning it over to Mayor Brandon Scott. Thank you.
Oh, I'm about to start singing on that. Good Lord. Anyway, good afternoon, you all. Thank you for having me. Thank you, sir, for that kind introduction. I am so sorry that I couldn't be here to welcome you all to Baltimore, but welcome to Baltimore. I had to stop by the conference before you guys in it to let you know how much I appreciate the great work that you all do in communities throughout the country. But of course, I'm a little biased to Kevin and the great folks here in Baltimore City. It's really an honor for me to be here, and I applaud each and every one of you because you all make the difference in so many people's lives each and every day. And you could have been anywhere else for this conference, especially in your usual spot in Chocolate City, but Obey is better than chocolate, so we're glad you're here in Baltimore. But I'm very glad that you're here, and I'm excited that we'll host you again in 2025. And we have a rule in Baltimore. Once you come twice, you never leave. So thank you for coming for eternity. As mayor of Baltimore, like many mayors across this country and cities across the country, we've experienced an increase in individuals experiencing homelessness and housing insecurity, especially during the pandemic. I recognize that homelessness is only a symptom of our larger challenges in our country that we have refused to address. It could be anything from the lack of affordable and adequate housing to restricted access to health care to long-standing and purposely designed racial inequalities to the lack of livable wages. These are the factors that force so many of our neighbors into homelessness. And like the cities you live and work in, Baltimore struggles with that limited availability of affordable housing, and more than half of our renters can't afford the homes that they live in. We've seen too many members of our community being at greater risk of homelessness, and that's why I can stand here as a great partner with groups like Healthcare for the Homeless and other housing developers to increase affordable housing and ensure that we make homelessness rare, brief, and non-reoccurring. Baltimore had the opportunity to join House America last year, and we were proud to say, Kevin, that we didn't just meet every goal that we set, we exceeded every single one of them. My mayor's Office of Homeless Services is the collaborative applicant for the Baltimore City Continuum of Care and has worked diligently to bring more resources to Baltimore. We've made strides in engaging people with lived experiences of homelessness into leadership and decision-making roles into this work, because if you're going to work on an issue, you have to work with, not for, but with the people who are directly impacted. Denise Smith of the National Association of Community Health Workers, who you will hear from next, we know, ma'am, that you share that commitment to center people with lived experience in the work. But we're also on the cusp of something I think is needed, not just in Baltimore, but across the country. I've long been a proponent of harm reduction strategies in Baltimore and appreciate the leadership of health care for the homeless and our health department to increase access to medication-assisted treatment, life-saving interventions like Narcan and syringe services programs. And as a mayor of Baltimore, I always have to lift up my predecessor and my forever mayor, Mayor Kurt Schmoke, who first brought that program to Baltimore, who first talked openly about how we can think about drugs differently in this country, and they told him he was crazy. And as I told him a few weeks ago, you look like a genius to me, Mr. Mayor, because we continue to do, and now that conversation has finally happened. But we know we have to go to the next level. For us here in Baltimore, and what we're going to push our state to do, is that we cannot continue to lose so many of our neighbors to something that we don't have to, and that's overdose. And when we look at places, not just in the States, but across the globe, when they have a simple thing like an overdose prevention site, they don't have what we have. And we have one choice, two really. We can either continue to do what we've been doing, and we all know in this room that it hasn't worked, right? Because we know why the populace and media and folks don't like to talk about overdose the same way that they would, for example, like to talk about gun violence. In Baltimore, we lose thousands of people to overdose every year, hundreds, 300 or so, to gun violence. Both numbers are unacceptable. But we don't have the same vigor, or folks don't put the same vigor into talking about overdose. Because as I often say, unfortunately, we have not evolved so many of our brothers and sisters and our family members to understanding that people who are struggling with addiction are human too. They are our family members. They are our neighbors. And we in this country have to get to a point where we understand that we're the ones that got it wrong, the rest of the world got it right, and we have to join them so that we can start saving lives. Enjoy the rest of your time in Baltimore. If you haven't already, make sure you get the best seafood that you'll find in the world. This is the best place to eat seafood. If you're looking for advice on where to eat a crab cake, it's Coco's Pub. That's K-O-C-O Pub. Tell them the mayor sent you. If you're looking for a crab cake anywhere else, tell them the mayor didn't send you. If you're looking to eat Maryland blue crabs out on the water and enjoy this weather, you can go straight up the street to Captain James, which has, today is Wednesday, which has a special you guys can get, and eat all the crabs you want. Enjoy it. Come back again and again and again to Charm City. But most importantly, thank you all for the life-saving work that you do in your cities each and every day. Thank you very much.
We have an appointment in 2 years. So make sure you tell everyone, make sure you come back in 2 years. We'll be right here, the same hotel, and with the same mayor. That's what we want. All right. So this conference, as you know, is Toward Justice, and the subtitle is Leading with Lived Expertise. And we've heard so much about it, and we are really fortunate in the council. From the very beginning, we've always listened to those with the lived experience and lived expertise of homelessness. And 20 years ago, that became formalized in the National Consumer Advisory Board. So it's one of our 3 networks, exactly equal with our clinicians network and our respite care providers network. And Deidre, start making your way up here. Deidre Young, who spoke a little bit this morning at our awards luncheon, is going to share some more words with us. Deidre? Thank you. Let's give it up for Deidre Young, NCAB Chair.
Well, apparently I did a good job earlier. I'm back. Thank y'all for being so supportive of me. Y'all are so wonderful with uplifting me earlier. But I would like to say again, it is our 20th anniversary of NCAB. Right? Oh my goodness. Oh, y'all didn't clap long enough. I was trying to get back to the worms. Hold on, I'm coming. Be patient with me. As we focus on leading with lived expertise, I'd like to share with you some of the things that NCAB has done in the past year and what we will do. Last year, the Consumer Leadership Summit, where we focused on equipping consumers to engage with their health center leadership and health centers to engage with their consumers. So of course, as most of you know, we do a CPO, which is a Consumer Participation Outreach Survey. It is created by consumers, it is given by consumers, and it is one of the ways that the consumer voice is lifted on how you guys can better serve us. So, thank you. We have our newsletter. I am the newsletter editor-in-chief. It is called The Consumer Voice. The Consumer Voice is written by consumers. We create it. We have our monthly meetings. We do the publications, and with the assistance of the council, we get it out to everyone across this nation that we have your email for. So with that being said, if you guys are not receiving the Consumer Voice, please, please reach out. Go to the website, nhchc.org, and you can sign up. We ask that you go back home and you inform your local cabs about what we do so that they can get involved. Now, this is a subcommittee of NCAB, and we have an open door policy that consumers that want to get involved has a space. There's been space created for consumers across this nation to get involved. And it's really important. When we first started the newsletter, it was about how many people can we reach? 60, the first issue. 100, the next issue. When we gave acknowledgement to Homeless Memorial, our newsletter was seen by over 900 people. Right? We were hoping for a couple of hundred, but it reached over 900 people. And up to date, we have published 18 Consumer Voice newsletters so far. Now, we've heard the voices of the consumers that said we want to be involved. But of course, NCAB, we have 12 members. But the body of the National Consumer Advisory Board is large and growing every day. So we have our Ellen Daly Advocacy Committee that individuals can join monthly calls. We have a beautiful setup. Charlotte Garner is the chair. And we're always welcoming and wanting folks to get involved. So if you know of any consumer at your HCHs that says, hey, I want to do something, I want to get involved with this, please, please reach out to us, because we want the involvement. We want to continue to strengthen and raise the consumer voice, because the consumer voice matters, and we are really worth it. Our goal is that every consumer can contribute to their health centers or medical respite programs, and every health center receives that contribution of hard-earned wisdom. NCAP stands ready to help health centers. Okay, so NCAP stands ready to help you guys. Okay, I had to think about that. Sorry, I just got this, y'all. I didn't have time to go over it and memorize it. But we are ready. We are ready. Go to the website. When you go to the website, top right corner, you're gonna see respite care, you're gonna see NCAP, you're gonna see Clinicians Network. Top right corner, click NCAP. You'll find all our information. And we would love to hear from you, especially me, because I get the emails. If you'd like to improve your consumer governance, please let us know. Again, we're here to help. And to end this, I would like to say it is such an honor to be here and to be the chair of the National Consumer Advisory Board on its 20th anniversary. So thank you all. Thank you.
Thank you. After we selected the theme, the staff looked at people, but one person we didn't even have to really look at because she was known to us. And we said this will be the perfect person, and we were just hoping that she would be available, and we're glad that she is. I first met Denise Smith on a Zoom call, maybe a little more than a year ago, when she was referred to me through my work with the COVID-19 Health Equity Task Force, and said this is someone you should look up. So arranged for a Zoom call, was immediately struck by her knowledge and her passion for really making sure that community health workers were incorporated into our health response. Others on our staff knew her well, and so I'm just going to read a little bit about Denise Smith, and then ask you to make your way, and the next voice we'll hear will be our keynote speaker for today. But let me just read. Denise Octavia Smith, I won't read all of her credentials, but they're there, is a woman of African descent. She's a community health worker and a survivor of a rare chronic disease. She is the founding executive director of the National Association of Community Health Workers. And during the COVID-19 pandemic, Denise partnered with global and U.S. organizations to center the experience of community health workers, their expertise, fighting for racial equity and authentic community-based partnerships. Mrs. Smith is a visiting scholar of the Harvard Medical School Center for Primary Care, an Aspen Institute Health Communities Fellow, and a Robert Wood Johnson Culture of Health Leader. In 2013, Denise partnered with hundreds of community health workers to achieve historic community engagement and enrollment of 30,000 residents into her state's Affordable Care Act Health Insurance Marketplace. Her research interests include building trusting and trusted relationships, patient and community-level health systems governance, health insurance literacy, and community health worker policy leadership. Please join me in welcoming, we're in for a rare treat, Denise Octavia Smith. Thank you.
Hi, how are you? Okay, you got a hyper one. I know it's the afternoon. If you need another cup of coffee, you might want to get that. I am full today. I'm so grateful to be here. Deidre, your name is Deidre? I've been seeing Deidre run around. She was outside and then in the hallway, and I didn't know who she was, but now I feel you. Now I get it. It's totally appropriate. Wonderful to be here. It's an incredible honor. You know, I just want to say my heart is incredibly full. I don't take these opportunities lightly. And so I'm going to share deeply. I'm going to share frankly. I'm going to share passionately. That's the only way. That's how my mama raised me, all right? So that's what you get. I want to start with a quick story. A couple of months ago, I was taking a flight. I'm from Hartford, Connecticut, and I was taking a short flight. It's only like an hour to DC. And I get on the plane. I'm sure you all have been on a plane before, and you leave, the gate, and you're waiting to take off, and then nothing happens, right? So it was one of those where it was like 40, 45 minutes where nothing was really happening. So whatever, I'm sitting there, and it's early morning. It's got to be like 6 a.m., which means I got up about 3 to get to the airport, so I'm very, very tired. So I'm thinking, I don't even care. I'm just going to slink back and like crash. I don't care how long we sit here. And there's a brother behind me, a guy sitting behind me, and he starts snoring really like really, really loud. And I was like, oh man. And he would snore so loudly that he would wake himself up. Do you have anybody like that in your family? Where they're snoring and they just sort of come to? All right. So we're sitting there. It's a true story. Now, I don't have to make this one up. It's a true story. About 40 minutes, and this happens maybe 4 or 5 times. So, I go from cool Denise, like it's all right, you know what I mean, to like a little annoyed, I'm in my seat. I was like, should I tell him, or should I turn around? You give people signals, like you move your chair or something. I was like, what can I do to let this brother know that it's a little annoying, like I just want to fall asleep? And he wakes up again, and this time when he wakes up, he starts addressing the gentleman who's across the aisle from me. So I can see who he's talking to, but I can't see him. And he wakes up and he says, I'm so sorry. He said, I had my kidney taken out a couple of weeks ago, and the medication that they're giving me for pain, I just fall asleep. And I'm thinking, this guy must have read my mind, right? It was an incredible moment, and I bring it forward, one, to tell on myself, because I do that a lot, but also to say that you never really know someone until you know them. You just do not. It doesn't matter what you're looking at. It doesn't even often matter what they say. It definitely doesn't matter how they dress, and it definitely doesn't matter what's on their resume, right? I come from a church background, and in the church we often say, I don't look like what I've been through. Have you ever heard that? All right, so I'm going to start there as a jumping off point, because we're to talk today about lived experience, and you all know where we are. We're in a very challenging time right now in our country. Just a couple of days ago, the Biden-Harris administration began the unwinding of the public health emergency. We have, within the first year and a half of COVID, millions of people joining Medicaid and CHIP. Over 92 million people, I believe, are enrolled in Medicaid. And now we're going to create numerous barriers for them to maintain their health care coverage so that they can prevent disease, so that they can stay out of the emergency room, so that they can access their medications. We're just going to make it a little tougher for them, okay? We have communities that are decimated. They were decimated before the pandemic, and they did not fare well during the pandemic. They are now emerging out of the public health emergency with hundreds and hundreds of mass shootings, rising rates of suicide, depression, teachers that are fleeing their school systems. We have communities and families and individuals who can't buy milk. They can't buy eggs. Okay, I know I run a food pantry. All right, I know who's coming. I know who used to come, and I know who's coming now. But people can't afford gas for their car. They can't afford their rent. They can't afford their mortgage. They can't afford their health care coverage. This is the state of the world. Meanwhile, we are still this strange beacon in the world. And we have tens of thousands of individuals traversing thousands of miles to make it to our borders. Borders, oh, by the way, just in case we got any history buffs in here, borders which did not exist oh so long ago. These places that we call Texas were Tejas, okay, colonized by the Spanish and then became free places. We've forgotten all this history, but we have tens of thousands of people who are asylum seekers, or guess what? Maybe they're just fleeing in search of a better paycheck, who are now hungry and homeless at our borders. Soon they'll be in cities all over the country, as I think you already know. Hartford and New York and DC and Baltimore, they're flying them to Martha's Vineyard. This is the world that we live in, and why is it important for us to level set in this reality, this historic, structural inequity upon marginalization that we've lived in for hundreds and hundreds of years? Because it's through this sordid history that we have this tradition of community health workers. And I know you're sort of like, what? Like, how did you get from there to here? Oftentimes, when I talk to people about the CHW profession, I say that this is an identity. It's not a job. It's an identity. I carry on this tradition. As a matter of fact, a young man, I was lost, as I usually am, and a young man brought me into this room to make sure I could get where I was going, and he said to me, why do you do this? Why do you do what you do? And he didn't know who I was, but he just, I guess, wanted to know, like, why I was here. And I said, I do this because I was raised on one of the only black-owned farms in Connecticut, in a small town called Ledyard. The border of our land was on the back of the Mashantucket Pequot Nation. At that time, it was a reserve because the people didn't have their land. And my grandmother would have me milk cows and gather eggs. I'd go to the slaughterhouse, I'd pick vegetables out of the garden, I'd pick pears and apples off the tree, and we were going to somebody's house to bring food. I made butter, right? I did those things, and she told me that's what you're supposed to do. Everybody can't go to the grocery store. Everybody doesn't have it like that. My mom cultivated a little more extroversion, okay? My grandmother was like, you catch more flies with honey than with vinegar. She had that sweet vibe about her, but my mom was hardcore. My mom, when I was 12 years old, 1982, gave me a t-shirt with a little cartoon penis on it, with a little cartoon condom, and it said, cover me, I'm going in. And she was like, I want you to wear this t-shirt all the time, you know? And my brother was mortified. He was like, why do we have to stand at the bus stop and you have to wear this t-shirt, you know? And I was like, I love it, I'm so hardcore, you know what I mean? I was like, I'm it right now. Everybody's looking at me, I just didn't know why, right? But we are called to do this work. And I know that, first of all, let me just ask, does anybody really identify with the title of community health worker? Is there anybody in here who has that title? Okay, and what I want to say, I want to thank everybody who has raised their hand, but I really want to lean into this. Okay, and if I'm going to run out of time, but I'm going to tell you why. I really want to lean into this identity, this calling. I believe that almost every person in here would raise their hand if I took the time to talk about lived experience. It is very much like, and Joseph, you mentioned this earlier when we were at the door. You mentioned this word key, and I said, oh my gosh, I'm in the house. Life experience cuts us. It wounds us. We're bent. We're broken. I've had 2 surgeries in the last year. I'm a survivor of a rare chronic disease. I am a frequent flyer. I'm that person who was in the emergency room 7 to 10 times a year because of my rare kidney disorder, right? I'm that person. I've lived in abandoned buildings. I'm that person. I'm that person struggling with substance use and abuse. I'm that person. I've been a single mom. I've been on Medicaid. I've received public assistance. I'm all those things and other things. And it's not that I'm proud of those things, but I recognize that those things have cut me in a particular way, that I am now a key for a very specific lock for this moment. And what I want to say to each one of you is that you are someone's key. Your life experience is someone's key, because they don't know how to say it, and they don't know what door to knock on, and they haven't had the victory over that thing. They haven't experienced peace, and they don't have their own key to their own home, and they're not managing their chronic disease well, but somehow you did. And it's that victory, that experience, that struggle that you bring to your work. Now, if I'm wrong, let me know. But if I'm right, let's clap it up for everyone who is brave enough to live out their experience. There are people like us all over the country and indeed all over the world. And we organize around the title community health worker. Okay? So I just want to level set on that. I've had many different work titles in my life, but it's that identity, that I have a commitment to the community where I live and serve. I have compassion, that I'm not judging people, that I'm coming alongside in humility and with my vulnerability, because you know what? As my grandmother would say, were not for the grace of God go I. I've been there. And I just, there's a lot that has been said about community health workers. When the Biden-Harris administration came in January 2021, shout out for this purpose. Every major initiative that they launched, the 2021 COVID response plan and the 2022 COVID preparedness plan, the February 2021 health equity task force, and the 2022 mental health strategy, and the 2021 American Rescue Plan Act, $7.6 billion, okay? Your tax dollars. Your tax dollars. We're going to come back to that in a minute. Your tax dollars. We need to know where all that went. Every one of those documents centered lived experience. It said we needed a community-based workforce. It said we needed promotores. It said we needed community health representatives from tribal nations. It said we needed peers. It said we needed outreach workers. It said we needed community-based organizations. But I bet if we follow all of those dollars, and indeed, the National Association of Community Health Workers has been tracking those dollars, a fraction of those dollars have actually made it to community-based organizations. And there is a reason for that. Systems were not designed for the most marginalized among us. Structures and policies that prefer academic hierarchies and professionalization. So the more letters I have behind my name, the more I'm valued. These are systems that are put in place to devalue our lived experience. But I can remember being an outreach worker, an HIV outreach worker in Hartford, Connecticut. I can remember having to train people with bachelor's degrees and master's degrees. And I was like, what is it with y'all? What are they teaching you? Y'all can't do street outreach? What is going on? I didn't understand. But it's because you cannot learn that from a book. You have to live that. You have to live that experience. And so during this last 3 years of the pandemic, the whole world has said, we need community trust. We need community-based outreach. We need to deeply embed and connect to community. And so a lot of money went out. A lot of money did not trickle down and trickle into our communities. And now in the unwinding, we can see more clearly. We can see who made out and who did not. Why is this so important? One, because these are our tax dollars. Two, because this is probably the largest public health investment we will, in our generation, we will ever see.
And we know from the de Beaumont Foundation's own data that the public health workforce is mostly white, mostly female, an aging workforce, and more important than all three of those data points, this workforce, in terms of its academic preparedness, does not have some of the competencies, some of the skills, some of the innovation that we need to reach every person, every marginalized and oppressed and othered community. We need change. So the last $3 billion of the American Rescue Plan Act was just distributed to all of your state health departments and many of the local jurisdictions. $3 billion focused on workforce. Let's think about that. Workforce in the public health construct for HIV and AIDS, for STDs, for oral health, for immunizations, for maternal and child health, for diabetes, for heart disease and stroke. Am I making sense? These are the issues of the people that you serve. These might be your issues. And we need to make sure that these investments make our communities better and not worse. So a lot of times community health workers are called to meetings. I'm sure many of you have been, and you've tried to lift up your lived experience and you felt, like sit over there kind of thing, you know? It's like being the only black person in the room and like, well, we need the black experience, like we'll ask you to come forward, but just chill over there, you don't have the right letters behind your name. But this is the moment now. This is the moment now for us to lean in to our lived experience, lean into our own value. I spoke this morning at a conference about this word empowerment. And empowerment, I was like, all right, let me see what Google says about empowerment. And empowerment is looked at in two very different ways. In one sense, it's something that someone else does for you. Like, I'm empowering you, I'm giving you this. But the other is taking charge, taking control of your own rights, your own future. And that is the reality that we are living in right now. I know amazing community health workers. I know there are amazing people in this room. But I just want to shout out Marta, who is a promotora, a grandmother working in El Paso. I was with her in October. And she crosses the border a couple times a week. And right now, she's digging into her own pocket to feed people who are coming across the border. Well, Marta gets $9 an hour for this work. I'm thinking about my brother Dean in Hartford, Connecticut, who's a community health worker, youth violence prevention interrupter. He's that person who goes to the ER when there's been a shooting to try and make sure that there's not retaliation. Well, Dean is also a minister, and he has to funeralize every time there's a youth that he's dealt with that has been brought down from gun violence. He's also the minister. I'm thinking about Majaline on the Navajo Nation. Majaline is an elder, one of the founding members of NACHWA, who during the COVID-19 pandemic told me that 90% of the CHRs, the community health representatives on the Navajo Nation, when they left work, when they left the clinic and went home, 90% of them went back to houses without electricity or running water. I'm thinking about Michaela, a woman that I hired from New Mexico, whose co-workers and colleagues in New Mexico told me, like, look, you better hire this woman. This woman is incredible. While she was in prison, she developed a program for women to reconnect with their mothers, and 300 women graduated. That's while she was still locked up. When Michaela came out, she started a youth program, and they said she saved over 50 lives on the street. And do you know right now, she's fighting to see if she can get an apartment because of her past criminal record. This is the reality. This is why we lean into our lived experience. I am not a service provider. I live this. And my colleagues live this. We are the people needing services. Just like we're trying to give those services to others. But we're in the fight to build bridges. let me just end with this. I'm sure I'm out of time. I want y'all to know this clock says 000. So either it hasn't been working the whole time or I'm way over time right now. Oh, either way, I'm about to take another 8 to 10 minutes because Bobby said I could. Listen, I understand that we are all just profoundly diverse here. And we have an incredible responsibility to lean into unity during this time. And I think what's amazing, and I'm sure it's been cultivated in your meeting, is that you can have such diverse experience, different faiths, different genders, different ethnicities. You're from different geographies, different races. You're refugees, asylees, you're have different mixed citizenship status, you're survivors of all kinds of things, but yet you can be here and have a unified thought, a unified focus, that you can want to push an agenda forward with unity in diversity. And this is what community health workers are trying to do right now, and why it's such a great honor to be the founding executive director. I was thinking about, like, how would I really end this time that I have with you? And I know that, they often say, like, people remember, like, the beginning of what you say, and they remember sort of like the end of what you say, the middle stuff, not so much. So I thought, all right, how do I really end this and make it very compelling? And so I love stories, so I figured I'm gonna share this story. Now, it's a very familiar story to, and anybody ever had to go to, like, Sunday school? Anybody ever remember Sunday? All right. Are there any Bible scholars in the house? Because, oh man, all right, well, if you have any question about this sister right here, this person right here, I'm not the Bible scholar, all right? But I do remember this story, and it's just incredibly appropriate for right now. So there's a conversation taking place between Jesus and this lawyer. And this lawyer's like, all right, you're talking about, like, eternal life. Well, how do I get it, And Jesus is like, well, love God and love your neighbor as yourself, all right? For this sister right here, it's Luke 10, all right? I know she's checking me now. They whipping out the Bible app. They're like, hold on. Get ready before she messes this up. Okay, so the lawyer's like, well, all right. I mean, it sounds okay. But lawyers, it's all about the details, right? So they're like, who is my neighbor? I need a little definition here. I can't just love everybody, love your neighbor. That's a little too broad, that's a lot of work, loving everybody. So I guess he wanted it out. So he's like, who's my neighbor? And so Jesus responds to this story, and he says, all right, well, there's a man, he's traveling from one city to another city, and on the road, he gets beaten up, he gets robbed, all of his clothes get taken, and he's left on the side of the road, left for dead. And 3 people come by. One is a priest. The priest sees him, crosses to the other side of the road, and continues on his way. Then there's a Levite. The Levite sees him, leans in, checks him out, continues on his journey. And then a Samaritan comes by. Now, you all have heard Good Samaritan. So if you never knew, why do we say, like, Good Samaritan? This is where it comes from, okay? So a Samaritan comes by. The Samaritan sees the man. He picks him up. He puts him on his donkey. He cleans his wounds with oil and wine. He brings him to this inn. He gives the innkeeper some money, and he says, look, I only got but so much, but I want you to care for this brother, make sure he has a place to stay and get healed. I'm coming back, and if you had to spend more money to get him well, I will make good on that bill when I return. Okay? That's the story. And I thought, all right, this is a great story for our time. What's this whole robbing thing? What about these people who beat him up? I'm just going to break it down for you. That's this world we live in. That's this world we live in. Everybody has been touched by structural racism, microaggressions, physical violence, othering, bias, prejudice, poverty. Everyone has been touched by the pains of this world. We have been robbed of some of our joy. We have been stripped of some of our energy and vitality. And many of us, even us who sometimes show up to work every day, often feel like we are left on the side of the road for dead. We wonder, does anyone really care? That's that how are you doing kind of thing, and you say, I'm fine, but you're really not fine. Okay? So those robbers, that's the world. Who are we? I think we have a couple roles in this story. I think we're the person that got beat up. But I also think we're the Samaritan. But let me go back to the priest first. The priest was the keeper of the law in Jewish tradition. And oh my goodness, if these laws aren't killing us right now, the laws that are working against humanity at this moment in time, I don't care if it's laws that instead of keeping the air clean, they're laws to allow people to pollute it. I don't care if they're laws that instead of keeping people in their apartments, they're laws that help us evict people. I don't care if they're laws that say your family, your whole family is poor, you should all be eligible and be able to get free food, but we found a little eligibility criteria. We found this thing, and so only your kids are eligible, you're not eligible. You're eligible, but your husband's not eligible. You're better off if you're single. Your husband can't live with you. If he's incarcerated, he can't be. The laws are killing us. But it's not only laws, right? Like the actual law. You know, you can think about police. You can think about that sort of violence. You can think about legislation and our powerlessness. Many of us don't vote because we don't feel like we have a voice. I want you to think about the priest as the law, but the Levite was different. The Levite, their job was like the moral police, right? So they were like, this is how you're supposed to live. Don't we have a lot of people like that on planet Earth right now? You're not supposed to do that. You're not supposed to love this person. You're not supposed to do that. You should feel ashamed to be like that. We have a lot of those people who are trying to crush the spirit of human beings because of who they are and who they want to be and how they want to live. Oh, by the way, it's not impacting you. There is no love for that other person. All you can see is their difference. And their difference is so offensive to you that you just will not allow it. Have you heard that neighbors have been pulling guns on one another? Have you been hearing that? There was a gentleman who heard some kids playing in the yard next to him, in his neighbor's yard. He went into his house, got his gun, and shot up the family. I'm talking at all levels. I'm not just talking about the craziness happening in Florida. Like I don't know what's going on in Florida. Maybe it's too much sun, instead of like not enough. Something is happening down there. I'm praying for the people in Florida. I'm praying for Langdon, LJ, the outreach worker, social worker, who's dealing with young people who have been kicked out of their families because they're non-binary or gender non-conforming and they're homeless now. They have no place to live. And all around them, the system is trying to shut them up and shut them down. I want you to think about the Levite in that way. But let's think about the Samaritan, and I'm going to close on this. If you know your Bible, and this sister, they know their Bible. The Samaritan was really an outcast, okay? The kingdom of Israel split after David's son Solomon kind of messed around. He had like 700 wives or something like that. He did. He had like 700 wives. And he had a son, but the son wanted to go one way, and then there was another guy, and so the 12 tribes split, okay? And as a result, there were some people who had some of the like traditional ways, but over time, when the rest of the kingdom of Israel was taken over by the Assyrians, these people were left with other types of folks. They just started to blend in and, they started to create their own different faiths and different stuff was going on. So when it came time for the kingdom of Israel to come back together, these people that we now call Samaritans wanted to come back. They're like, we're family. You know what I mean? We got cousins and, your grandmama's my grandmama, that kind of thing. And they said, oh, no, y'all are different now. No, you eat different food now. No, you've married different people. No, I'm sorry, no. You pray differently. No, you can't come in. And so the Samaritan is this outcast, what was a part of the community, but now has experienced this marginalization. And Jesus actually talks a lot about Samaritans, if you read what he said. But the Samaritan, my question is, why would Jesus make the Samaritan the hero of the story? Why the Samaritan? Why not the priest? Why not the Levite? Why not the keeper of the law? Why not the moral police? Why the Samaritan? The Samaritan was the one who knew what it was like to be ostracized. The Samaritan was the one who knew what it was like to be cast aside. When the Samaritan saw the person on the side of the road, bleeding, no clothing, beaten up, and left for dead, the Samaritan could see themselves. And I believe that our lived experience is the key for those who have been left on the side of the road. I believe that we can come together. I believe that leaders like the leaders here at the National National Healthcare for the Homeless Council, the National Association of Community Health Workers, many others. I know there are many powerful, influential, resourced organizations here. What can you do? You can step back and let lived experience come forward. You can show in your budget your values by paying people for their lived experience. You can hire people based on their lived experience and not just look at their resume. You can hire people who are trusted in the community, who have lived it. The reason I can bring someone out is because I've been there. Those are the people you want to hire. Those are the people you want writing policy. Those are the people you want destructing your administrative burdens and all your intakes and all the forms. They're going to cut through all of that and say, this is what you need to ask, and this is what you don't need to ask. This is extraneous, and this is important. This will help people live a healthy, prosperous life, and this will just be more paper that we're going to file. I'm so excited to be here this afternoon, and I know you're getting ready for this rally. I think we all know the city of Baltimore has been through a lot, and I know you all are going to go out and love on this city and make sure that people know that they have advocates, not only here in Baltimore, but all over the country. The National Association of Community Health Workers stands with you. I'm going to be out with you. I got an invite from Joseph. He said I could come, so I'm coming. You know, I'm rolling. And I'm gonna meet him in Texas because our conference this year is in Austin, Texas, August 3rd through 5th, and we would love to have you as our guests. I pray that all is well with you, your families, and your communities. Please, please, please value your lived experience. Tell your story and make sure your story is heard. And for all you allies, create some space and make sure the story is told. Thank you very much.
The only fitting thing after that is to say, amen. Which means, may it be so. May what she said, the society, this is bringing it full circle, said that justice is what love looks like in action. Creating the society that has the response that we would want if we were less fortunate, if we had more disadvantages, and when we mess up and make mistakes. So thank you so much, Denise. We are so grateful that you are here and sharing your experience, your expertise, your wisdom with us. I will never forget the metaphor of the key, of us being cut by life's experiences for a particular purpose to open the door for others. Thank you. Some housekeeping as we officially close the conference. Please come and join the rally. Denise is going to be there. We may put her to work, advance notice. We will be meeting in the lobby at 5:15, so in just a few minutes, and then we will walk over. For those who cannot walk or choose not to walk, we will have a bus that's ADA compliant, can sit up to 50 people. There will be in the lobby. Just go out on Columbus Way, and the bus is between the hotel and the garage. This has been a great conference. We have still another day of learning labs for those of you who will be here tomorrow. Please, please, please think about joining as a member of the council so we can continue our advocacy work, which is not supported by federal funds. We want to make sure we can keep this going strong, that we can lift up your voice, your experiences, and we can keep having wonderful speakers like this in our conference. In conclusion, I just want to say this has been a great conference. You have been so accommodating, so patient, so loving towards each other. It's a highlight of many of our years, and certainly for mine. And I want to remind you, next stop, Phoenix, May 2024. Hope to see you there. We've sold out the last 2 years, so register early. Thank you all.